Can you tell us what an acoustic neuroma is and what types of people develop these types of tumors?
So acoustic neuromas are a tumor that occurs in humans. They're also called vestibular schwannomas, and we'll talk a little bit about why there's those two names. Acoustic neuromas were the original name for these types of tumors because historically patients would present with hearing loss and ringing in their ears, commonly called tinnitus, and it was thought that the disorder came from the hearing nerve. However, as we gained a better understanding of these types of tumors, it was clear that the tumor originated off the balance nerve called the vestibular nerve, and it's a type of tumor called a schwannoma, and therefore it's called a vestibular schwannoma. That's the correct name for this type of tumor. But because of the history in calling these acoustic neuromas, they're often referred to as acoustic neuromas by many physicians and patients. These types of tumors grow off nerves that are located in the internal auditory canal, which is essentially the inner ear. Acoustic neuromas are actually outside of the brain itself, but they're located inside of the skull. So we call them a type of brain tumor, but they're technically right outside the brain on the surface of the brain. Now, as they grow inside the skull, they can put pressure on these nerves, and that results in the dysfunction that we see with many acoustic neuromas. Additionally, as they get larger, they can put additional pressure on the brain itself. And acoustic neuromas are located in the back of the brain and what we call the posterior fossa. And they would put pressure on the cerebellum, which is the part of the brain in the back of the head that controls balance and coordination. So that's another type of symptom that we can see with these types of tumors as they enlarge. Acoustic neuromas are considered benign tumors in the sense that they are slow growing and that they don't spread around the body like malignant tumors. They're not considered a cancer. On average, they grow 1 to 2 millimeters per year. However, this is just a rough average, and we have some patients in which the tumors grow faster than 1 to 2 millimeters a year, and we have other patients in which tumors don't grow for quite a long period of time. In addition, the growth rate may be variable from year to year in a patient. A tumor in a particular patient may grow slowly the first few years it's known to exist and then accelerate, or it could cease growing after a number of years of progressive growth. We do know that acoustic neuromas can occur in any age group, although it's less common to find them in patients under the age of 20 to 30 years old. And in fact, if we do see an acoustic neuroma in someone who's 20 to 30 years old, we typically do consider doing a genetic workup to see if they have a genetic version of the tumor, which is called neurofibromatosis type 2. It's a genetic disorder that is typically associated with the patient developing acoustic neuromas on both ears. But keep in mind that this genetic disorder is not very common and represents less than 5% of patients with acoustic neuromas. So most patients will develop what we call a sporadic acoustic neuroma. It's a tumor located on just one side or the other, with the two most common symptoms being hearing loss and ringing in their ears.